Everyone talks about dry eyes with Sjogren's, and almost no one talks about your heart and cancer risk. Let's change that. Hi, I'm Dr. Kara Wada, quadruple board certified allergy, immunology, lifestyle medicine physician, and I live with Sjogren's and dysautonomia myself. Today, we need to have a conversation that most rheumatologists are not having with their patients. Picture your typical Sjogren's checkup appointment. Your doctor asks about your dry eyes. Are they any better, any worse? They check your mouth. Are you using the right rinses? They might adjust your eye drops, prescribe a new saliva substitute. The entire visit is focused on managing dryness. And that makes some sense. Dryness is uncomfortable. It's visible. It affects your daily life. But here's what almost never gets discussed: your cardiovascular risk and your risk of lymphoma, the silent systemic inflammation that's quietly shaping your health 10 years from now. It's like having a team of experts focused on patching the peeling paint on your walls while completely ignoring the slow, silent cracks forming in the foundation of your house. Today, we're going to talk about the part of Sjogren's that gets ignored. We're going to look at the actual scoreboard for your long-term health, and I'll explain why understanding these silent risks is the most important thing you can do to protect your future. Let me explain why this happens, why we focus so much on dryness and so little on systemic risk. Dryness is visible. It's annoying. It has some immediate solutions. You can put in eye drops and get pretty instant relief, albeit temporary. You can use a mouth rinse and feel better within a few minutes, for a few minutes. There's a clear problem and a fairly clear intervention. Because dry eyes and dry mouth are the hallmark symptoms of Sjogren's, because they are the aspects of Sjogren's that are on our board examinations and are tested, they naturally become the center of attention for both patients and physicians. They're tangible. They're measurable. They fit neatly into a 15-minute appointment. But this dryness fixation means that we miss the chance to understand and track the bigger, invisible risks that are shaping our long-term health. Let me put it bluntly. Shogi's eyes get the eye drops, your immune system gets ignored. Here's what you need to understand. Managing dryness is important for quality of life. I am not minimizing that. But it's symptom management. It is not disease management. Treating your dry eyes does nothing to address the underlying systemic inflammation that drives your long-term risk. It's the difference between turning down your car radio when you hear a strange engine noise versus actually opening the hood to see what's wrong. Now let's talk about what actually matters for your 10-year, 20-year, 30-year health outcomes. Let's look at the real scoreboard. I'm going to be direct with you because you deserve the truth. Multiple long-term studies show that people with Sjogren's have a significantly higher risk of developing certain types of B-cell lymphoma compared to the general population. How much higher? Some studies suggest 6 to 16 times higher risk than someone who doesn't have Sjogren's, depending on which specific type of lymphoma we're talking about. Now, before you panic, let me give you the full context. The absolute risk over 10 to 15 years is still in the single-digit percentages. We're not talking about certainty or even a high probability, but we're talking about an elevated risk that needs to be monitored. This isn't meant to scare you. I really want to help empower you because here's what matters. There are certain risk factors we can track: persistently swollen salivary glands, low complement levels, certain antibody patterns, persistent lymphadenopathy or swollen lymph nodes. These are things that can be monitored over time. If you're working with a rheumatologist who's never discussed lymphoma risk with you, who's never examined your lymph nodes or asked about persistent swelling, there's a gap in your care. You should know your risk profile, you should know what symptoms to watch for, and you should know how often you need monitoring. The cardiovascular risk is even more underestimated than lymphoma risk, and honestly, it affects a whole lot more people. Here's what's happening. The chronic inflammation from Sjogren's, like other autoimmune conditions, acts like gasoline on the fire of the cardiovascular system. It accelerates atherosclerosis, that's the buildup of plaque in your arteries, and it increases your risk of heart attack and stroke. Here's the kicker. This often happens independent of traditional risk factors like cholesterol or blood pressure. You can have perfect cholesterol numbers and still have an elevated cardiovascular risk because of the chronic inflammatory load from your autoimmune disease. Research shows that women with Sjogren's have cardiovascular events at younger ages and with less warning than the general population. The inflammation is quietly damaging blood vessels, making them less flexible, more prone to clotting, and more likely to develop dangerous plaques. But how often do your doctors talk to you about your cardiovascular risk? And how often do they connect the dots between your Sjogren's inflammation and your heart health? In most practices, it's almost never. They're focused on your dry eyes and mouth, while your cardiovascular risk is accumulating silently in the background. There's one more risk factor that gets even less attention, but is incredibly common: the metabolic consequences of living with Sjogren's. So let me explain the cascade. You have dry mouth, makes it harder to chew. So you naturally gravitate towards softer, easier to chew foods, tend to be higher in carbohydrates, lower in protein and fiber. You're fatigued, so you move less. You might stop exercising because it's really just too hard. You're dealing with chronic inflammation, which itself drives insulin resistance. Over the months and years, this pattern can lead to weight gain, muscle loss, metabolic syndrome, prediabetes, and even over into type 2 diabetes, all of which further increase your cardiovascular risk. It's a downstream effect of coping with your symptoms, but it comes at its own risk multiplier. And again, how often is anyone talking to you about this? How often is someone connecting these dots and helping you create a proactive strategy? The frustrating reality is that we spend so much time managing the dryness symptoms that we completely miss the opportunity to prevent the metabolic complications that make everything worse. I'm going to say something provocative. If no one has ever walked you through your personal lymphoma and cardiovascular risk with Sjogren's, you have been medically undereducated and not over-researched. You are not being anxious and wanting this information, and you're not being difficult by asking these questions. You're being an informed patient who deserves to understand the full picture of your health. The standard of care in many medical practices is symptom management without risk stratification. And frankly, that's not good enough. You deserve to know your specific risk factors for lymphoma, your cardiovascular risk adjusted with autoimmune disease in context, your metabolic markers and trends over time, what monitoring you need and how often. You deserve a team that looks beyond your dry eyes and sees your whole body and your whole future. So what do you do with this information? How do you move from awareness into action? First, understand that dry eyes are just the part you can see. The systemic inflammation, the part driving these long-term risks, is invisible. You can't really feel it accumulating, aside from the fatigue and body pain and all that stuff, right? You can't necessarily see it on the surface. But that's why you created the Immune Confident Inflammation Scoring System. It's a quiz. It's designed to look at the part you can't see yet. It assesses the drivers of your systemic inflammation, the very thing that contributes to these long-term risks. It's not just about tracking symptoms. It's about understanding your inflammatory burden across multiple body systems. And it's about seeing which of the forces is driving your personal risk profile. You can take the 5-minute assessment, get your score, and I'll send you personalized information about what that score means for your cardiovascular, metabolic, and cancer risk. This is the first step in creating a proactive, long-term health plan instead of just reacting to our symptoms. So to bring this home with something I need you to remember. Sjogren's is not just a disease of dryness. It is a systemic, autoimmune, inflammatory disease. And protecting your future means looking beyond your dry eyes and dry mouth and focusing on your foundational health. Your dry eyes are not going to kill you, but unmanaged cardiovascular disease might. Metabolic complications might. An undetected lymphoma that goes for years without being identified might. And I'm not saying this to scare you. I'm saying this because you deserve care that matches the reality of your disease, not just the most visible symptoms. You deserve a care team who discusses more than just eye drops and saliva substitutes. You deserve monitoring that goes beyond dryness scores. You deserve a long-term strategy that protects your heart, your metabolic health, and catches concerning changes early. So here's what I want you to do right now. Click on the link in the description and take the Immune Confident Inflammation quiz. It's time to see the part of your health story that has been invisible. Bring your results and that printout to your next appointment, and you can ask about lymphoma monitoring protocols and about cardiovascular risk stratification. You can ask about metabolic screening. If your doctor seems surprised by these questions or dismisses them, that might be a sign that you need a little extra help on your team. Save this video. Share it with another Sjogren's patient, autoimmune patient that needs to hear this message. This information should not be a secret. It should be standard of care. Please subscribe to this channel for more content that goes beyond symptom management and helps you build a real, comprehensive health strategy. Remember, you are not being dramatic for wanting to understand your risks. You're being smart and you're being proactive. You're taking control of your long-term health, and that's exactly what you should be doing. Until next time, be well.